still live here with your Feel Good Breakfast Show team here on S3. It is Health Tuesday and it's time to get into a very important conversation. Now, according to the Cancer Association, breast cancer accounts for 16% of all cancer deaths in South Africa, a major public health problem. A large majority of women in South Africa present with late-stage diseases, which is tragically associated with a poor prognosis. However, October is Breast Cancer Awareness Month in South Africa, and we are joined by specialist surgeon Dr. Justus Apffelstaedt to raise awareness on this disease that affects all ages, cultures, and races. Doctor, as always, it's so good to have you back with us.
Good morning, Jamie. Good morning, Graham. Good morning, viewers. It's great to be with you. Thank you for inviting me.
Great to have you here. I know you've got to race off to theatre almost moments after this, so good to have you here during a vitally important time. When I talk about these kind of stats, 1 out of 7 women in South Africa will have a risk of developing breast cancer in their lifetime. This is obviously an awful statistic. At what age should women, ladies, start doing self-examination, start checking for the lump, the dreaded lump?
I think it behooves mothers to educate their daughters to start examining as soon as breasts develop, so that the women develop a routine, and it's being done on a regular basis throughout the life. It's a good health habit.
Yeah, just make it part of the routine, yeah.
Of course, self-exam techniques has been covered widely throughout, encouraging women to do this regularly. For those people that don't know how to do it, maybe you can help women explore that and do self-exam techniques at home.
And what should you be looking for, essentially?
Essentially, you should be looking for painless lump. Okay. And the way to do is if you're lying in bed on your bed and you're creaming your body, for example, with some form of body cream, just go circularly around the breast and feel whether there's a new lump there. Go also into the underarm area and see whether there's a hard nodule present there. Do this once a month after your menstrual period.
Okay. And
if a lump persists after the next one, then go and see your doctor. The other way, obviously, to remember it is depending on your the way you look at life. If you get the paycheck on the same day, or if it's the first of the month or the full moon.
You said it's usually a painful lump, but what if it's not?
A painless lump.
Painless. But what if it is painful?
Painful, it should be checked out too, but the majority of painful lumps are due to changes in the menstrual cycle. They are cysts which are harmless. They are just inconveniences and nuisances.
A painless lump, is a lump always cause for alarm? And are there other symptoms that can possibly indicate that we are drifting into that dangerous space?
Yes. Principally, there are also painful lumps that can be cancer, but the vast majority are not cancerous. So a lump is always good to have checked out. Secondly, if the nipple becomes skewed, becomes pulled in, if there is a change in the skin surface, that there is a bulge at some area of the breast, or the skin thickens in comparison to the other breast, that's cause for alarm. Obviously, in late-stage presentation, we have ulcerations of the skin. That means the skin is broken up, and that is really late-stage presentation.
Doctor, how do we prevent this? How do we lower our risk of getting breast cancer in women?
Breast cancer, to me, falls into 2 categories. Number one, the very young patients often have a genetic predisposition. But this is the vast minority of cases. We think that only about 1 in 10 has got a significant cancer predisposition due to genes. For the other 90%, I call it lifestyle disease, which is increased by the very well-known factors that we all know about: obesity, wrong nutrition, alcohol abuse, lack of exercise. Just to give you an example, if we look at a woman that is grossly obese, and we have in South Africa an avalanche of obesity, it increases the breast cancer risk by about 50% plus.
50?
50.
Wow.
Yes.
That is crazy to me. How often should women be then going for a mammogram? Should it be an annual exercise?
It should be an annual event. That would be ideal, because then we discover the breast cancers early. It is very important to state that mammograms do not prevent breast cancer, but they're very effective in preventing you from dying of breast cancer.
Early prevention.
Early detection is very important. We have shown in our own unit that if we discover a breast cancer that is early at mammography, then the chances of long-term survival are the same as if the woman were not to have any breast cancer at all.
Really?
Not only that, but also the treatment is much less intense. We need much less chemotherapy, for example, the dreaded chemotherapy. We need much less biologicals, which are actually very expensive. So it makes an awful lot of sense.
We love it. Thank you so much. Hugely interesting discussion. We always love connecting with you, especially around such vitally important times. We are talking about breast cancer this morning, and you can head over to the Expresso Morning Show if you want to share any stories with us, some stories of hope, some stories of warning. Maybe you've got some questions you want to pose. Please head over to the Expresso Morning Show Facebook page.
It's my feel-good breakfast show.
Welcome back. You are still locked into a healthy Tuesday here on Expresso, and we're going to continue our discussion now around breast cancer awareness with specialist surgeon Dr. Justus Apffelstaedt to raise awareness on breast cancer that affects all ages, cultures, and races. And I think the big take home for me when dealing with breast cancer specifically is that it is preventable if we get in with early detection. So if we take nothing away from today, test yourself regularly, do regular checkups, make sure you're going for a mammogram at least once a year. But of course, we opened the airwaves and we've got some questions coming through from our audience.
Yes, we have one from Linda Tolo that says, good morning, Expresso Show. When your breasts itch and it itches extremely for years, what does it mean, doctor? What does it mean?
That's quite a broad one.
Graham suggested it means you will get rich pretty soon, but then he's not
I'm
the expert.
hoping for you, Linda. I hope so, yeah.
Yes, generally it's a nuisance problem, and we see it at times around menopause, but there's no good explanation for it.
Really? Okay.
And there are some things that we really can't explain. Please have a look at whether you are having some form of material in your brow that makes or gives you a contact eczema or something similar or irritates you. That would be my suggestion.
We used to say if your breast is itching when you're growing up, it's growing. So maybe, Linda, your breast is just growing.
It's still happening. I mean, if it persists or if it looks like it's topical, then you can look the root of, is it a fungal or some kind of skin issue in that sense. BRCA.
Baraka?
Baraka. Do you pronounce it Baraka? In terms of BRCA1 and BRCA2, the genes that now have been identified as playing an important role in fighting cancer, when a person tests positive for BRCA gene mutation, what does that actually mean?
Let's go back one step. BRCA1 and 2, I call them breast cancer genes 1 and 2.
Okay.
And they're about to undergo a name change, by the way.
Really? Okay.
Yeah. They were the first genes to be discovered in women to give you a very high risk of breast cancer. If you have, everybody of us has 2 copies of that gene. You and Jamie and me, everybody here in the studio, everybody in the world has got 2 copies of that gene. But if one copy is defective, your chance of getting breast cancer during your life becomes very high, and especially if you're young. So, in these gene abnormalities that we can pick up, the chance of breast cancer during your lifetime is somewhere between 60 and 95%. So that's actually very high. And it's for this group of women that we often suggest risk reduction surgery, which means taking away the glandular tissue underneath the skin, replacing it either with own tissue or with prosthesis, and then closing things up. It leaves the woman with a normal, healthy-looking breast, but the risk of developing breast cancer after this operation is actually lower than that of a normal woman in the street. So it's very highly effective in the prevention of breast cancer.
When should women consider getting the test, and what exactly does this test involve?
We have advanced far beyond BRCA1 and 2. That was initially in the early 2000s. We started testing for BRCA1 and 2. Today we do panel tests. We're testing for 84 genes that all are important in causing breast cancer. This is how far we have advanced.
Sure.
And it involves, number one, a consultation with somebody who's interested in that. And we've had a very big interest for a very long time in this. And that you are aware of the implications of the test. Then it involves a blood test these days. We have the result within 3 weeks. The blood test is sent overseas, and we then can consult you and tell you what your individual risk of breast cancer is. But I want to emphasize here, breast cancer genes 1 and 2 are a misnomer, because they're not only causing breast cancer, there are additional cancer risks involved here, because once you have survived the breast cancer, then you're likely to get ovarian cancer for BRCA2, BRCA1 and 2. For example, for other genes, the MSN genes, if there's a gene abnormality, you might get colon cancer, and so further and so forth. So it has become a very complex field. And once again, I want to emphasize that these genes are present not only in women, but also in men. We must also talk to the men, because they have also specific cancer risks, because these are general cancer predisposition genes. They're not only linked to breast cancer.
Okay. I mean, I know we still have a long road to walk, but it feels like we've made massive advancements. So thank you for applying your intellectual might. And I know you've got to go and apply that to an actual real-time situation in just a moment. So we've got to let the good doctor go and perform a surgery now this morning. Thank you, as always, for some incredible insights. You really do help us to understand it on a very practical level. And if you are seeking assistance in your own cancer journey right now, reach out to the Cancer Association by calling 0800 226622, or you can simply WhatsApp 0721979305 or 0718673530. And to all of our cancer warriors out there, we are sending you so much love and support right now.